Ciao mondo, hello world, hola mundo, hello monde. I'm just back from ERA EDTA meeting in Copenhagen, and I had the pleasure to follow a series of presentations speaking about end of life and possible conservative management of chronic kidney disease. In many patients, especially elderly or with very low expectancy of life or with comorbidities, the initiation of renal replacement therapy by dialysis or peritoneal dialysis may represent a dramatic condition rather than an improvement in their morbid condition. For this reason, many people have identified the possibility to follow these patients with conservative management, which is not to renounce to do dialysis, but it is a positive choice to do conservative treatment instead of renal replacement therapy. There is even a proposal to create within a group a kidney palliative therapy group that may follow specifically these patients, not only the patient but also the families. In our group here in Vicenza, we have been adopting this approach since a couple of years now, and we have a specialist of palliative care joining us once per week in the discussion of difficult cases and problematic issues, especially in those patients where the choice of conservative therapy may be probably the best choice for their life. Assuming this is a good approach, we advocate the possibility that more and more we discuss with this kidney palliative care group, and the possibility also to make people, patients and families understanding that this choice is for the benefit of the patient. Of course, it has to be a kind of agreed decision, and a lot of discussion should follow the initial proposal or approach. But what is important to know is that in case of any emergency or complication, this patient should not undergo emergency dialysis because the choice is to avoid this renal replacement therapy. It is a complicated issue. We will have probably more to discuss in the future, and I'm very glad that at the ERA EDTA meeting in Copenhagen they started to discuss this opportunity, because I think for the years to come we have more and more of these issues to debate, and hopefully we will come up with a specific policy. The policy of course requires the presence of decision-making entities, including the governments, healthcare providers, the hospital direction and the physician themselves following the patient, but also involves a connection with the families and with the patient himself. With this, thank you very much for joining today, Cappuccino. This is a tough topic. I think we need to discuss more in the future, but for the moment, let's have a cappuccino together. Excellent. Thank you.